Welcome to our second Global to Local speaker series. Before we get started, I want to remind you that the program is being recorded and will be uploaded on YouTube soon after. We also have a feedback form that should be sent after the event, and we would love to hear your thoughts and suggestions. Joining us today, we have Dr. González. He is an associate professor of English and creative writing at Wellesley College, where he teaches courses on American queer literature and culture, British and American modernism, and the 20th century novel. He is currently a distinguished visiting scholar at UB as well. His monograph, Misfit Modernism, Queer Forms of Double Exile in the 20th Century Novel, was recently published in the Reconfiguring Modernism imprint from Pennsylvania State University Press. He's working on his second monograph, AIDS Pandemic Icons, on the successive moral panic and their homophobic iconography, which have defined the epidemic of significance regarding HIV AIDS from 1981 to the present. He's been a recipient of many notable awards, such as the Woodrow Wilson Career Enhancement Postdoctoral Fellowship and Newhouse Institute of the Humanities Fellowship, and many more. Tavi's fun fact is that he likes to watch YouTube videos about pop culture and listen to tennis podcasts. Thank you for joining us today, Dr. González. I will turn it over to you.
Okay, thank you so much, everyone, for joining me. I'm Octavio González, and I'll be talking a little bit about my work in progress. The title of this talk is Pre-Exposure Prophylaxis, the Truvada Whore and the New AIDS Panic Icon. So I'm going to share my screen and launch into my talk. Okay, and Okay, great. So my first point in this talk is that in sex panics about HIV, barebacking, and bug chasing, we continue to relive the original trauma of AIDS. We cycle through passionate debates about the moral and behavioral risks of HIV transmission and queer sex that recapitulate the original gay men's health crisis. As many of you know, once AIDS was linked to sexual transmission, a moral panic set in. Community leaders advocated shutting down bathhouses, promoting safer sex, and ending promiscuity. So AIDS meant the end of gay sexual liberation. It transformed the meaning of male-on-male promiscuity from a form of queer kinship to an irrational, irresponsible, unsafe, even deadly sexual behavior. Having anal sex without condoms became a relic of the disco era, replaced by the condom code. Preventing the exchange of body fluids became not only a public health mandate, but a categorical imperative. And first, I'll share these two ads from the era. This one is a Durex advertisement, which reads, "Nowadays, when you have sex, you need to protect yourself. Condoms are the only sure way of reducing the risks of unplanned pregnancy and sexually transmitted diseases, including HIV/AIDS. As you can see, this is from 1994, which is a really important date. The next ad, "Don't turn away from safer sex. If you're young and in love, it might be tempting to stop using condoms. The truth is that lots of people are affected with HIV in a relationship. Show them you love them and use a condom." Now, this article, also from 1994, summarizes the mass behavioral shift. For sexually active people, and for gay men in particular, the answer to the epidemic, our magic bullet, is the condom, a thin layer of latex to shield us from infection and death. AIDS organizations run largely by gay men announce a message that sex is fine, that anal sex is fine, so long as a condom is used. These organizations imbue the directive about condoms with the force of a moral code. Not wearing a condom is not simply unwise, it is wrong. Not wearing a condom violates obligations to other gay men and, in the views of some, obligations to a larger gay community. The author adds that the moral directive was hugely successful. Quote, "Men who have sex with other men made huge changes in their sexual behavior, changes that researchers in public health regard as among the most profound they have ever observed," end quote. However, with the advent of combination therapy and the protease inhibitor in 1996, for just 2 years after this, the staggering number of AIDS-related deaths began to subside in the US. Around the same time, the term barebacking entered the gay cultural lexicon, denoting anal sex without condoms. The term that launched 1,000 moral panics is on the February 1999 cover of Pause magazine. The cover reads, "Tony Valenzuela and the boys from bareback take you on a ride inside," and the feature is titled "They Shoot Barebackers, Don't They?" by Stephen Gendon. Barebacking here is first presented as an underground sexual practice among HIV-positive AIDS activists, no less, in radical defiance of the norm. Another AIDS activist, Stephen Gendon, who is the interviewer, interviews Tony Valenzuela, described as, quote unquote, the poster boy of unsafe sex. Valenzuela discusses how he became a, quote, pariah of the movement once he, quote, confessed to loving anal sex without condoms to a crowd of 2,000 gay and lesbian honchos, end quote. Valenzuela becomes a sacrificial lamb at the altar of AIDS, angst, and anger, Gendon adds, in the community sex wars that ensued. This pause feature foreshadows that by the turn of the millennium, the condom code was breaking. Barebacking behavior evolved into a social world unto itself, barebacking subculture. The practice of barebacking thus began among HIV-positive MSM, or men who have sex with men. And as Tim Dean claims, after 2 decades of safe sex education, erotic risk among gay men had become organized and deliberate, not just accidental. Despite the pariah that Valenzuela became, barebacking among HIV-infected men was a mode of risk reduction. Those already infected had little to lose. The data about reinfection was inconclusive, Dean adds. So by the mid-2000s, barebacking exceeded the original bounds of the pause subculture, becoming prevalent in gay porn, for example, and then becoming more visible, if not more widespread, among your average men who have sex with men. For example, in my years as an HIV prevention counselor and AIDS researcher, there was a constant concern about the erosion of safer sex norms among MSM. And I did that work before grad school between 1999 and 2005. So today, the end of the condom code looks very different, given new biomedical regimes for controlling and preventing HIV. The first breakthrough was treatment as prevention, which became a way to lower transmission rates by treating HIV-positive individuals to lower their infectiousness. The successfully adherent person will become undetectable, meaning lab tests cannot find the virus in their system. Undetectable means untransmittable, as the new slogan goes. The more recent and controversial development began in 2012 with Truvada. A combination of 2 antiretrovirals, emtricitabine and tenofovir, Truvada was proven to prevent HIV infection in large clinical trials across the globe. This prevention regimen for the uninfected is called pre-exposure prophylaxis, or PrEP. All studies have shown the efficacy of PrEP in preventing transmission. The level of protection from PrEP can be as high as 99% if the pill is taken daily, with or without condoms. As of July 2021, the most recent numbers that I have access to, according to a study in The Lancet, by 2019, 120 of 180 countries, or 2/3, had adopted WHO PrEP recommendations into national guidelines. In 2019, there were about 626,000 PrEP users across 77 countries, including 260,000 in the region of the Americas and 213,000 in the African region. This is a 69% increase year over year from 2018. Now, obviously, without the COVID-19 disruptions, they would anticipate even more PrEP users. However, projected use will be between 2 and 3 million by 2023. So PrEP had a very slow uptake, but it is accelerating, as we can see from this slide. And the next slide shows you the mapping of PrEP. So all the green areas are where PrEP has been officially sanctioned, which means it is available through insurance for those who are HIV negative and seek to remain HIV negative. Now, by the time of this talk, another drug, Descovy, not Truvada, but Descovy, has been approved for PrEP very recently. However, it has not been tested nor approved on people assigned female at birth, in a controversial oversight by the drug maker Gilead. Descovy has less renal toxicity than Truvada, which is one of the side effects of regular PrEP use. Truvada is now available in generic form, which might indicate why Gilead switched to Descovy for its marketing of PrEP. The financial incentives are one area of criticism AIDS and HIV activists have launched against Gilead with good reason. The moral criticism, however, is unwarranted in my view. 2. Biomedical treatment and prevention, including PrEP, have profoundly changed how individuals calculate HIV risk, especially sexual risk. Savvy early adopters, mostly among MSM, are turning to Truvada as PrEP, now Descovy as PrEP, and many are barebacking with little fear of seroconversion. Among these is Damon Jacobs, the world's first and foremost PrEP activist and the founder of the Facebook group PrEP Bats, which has over 21,000 members as of October 2021. So now if you go on gay dating apps or websites or Facebook, you will see a proliferation of HIV statuses, from undetectable to HIV negative on PrEP. And this brings me to my next point. The proliferation of new HIV serostatuses, such as undetectable as opposed to positive, those are not synonymous, or HIV negative on PrEP versus HIV negative, which again are completely different statuses, points to a major shift in the history of sexuality. Along with the rise in barebacking, PrEP and treatment as prevention are transforming the sexual ecosystem, though primarily among MSM in the global north. That said, however, as you saw from the map, this is accelerating across the globe, including in the African regions. This new era began in similar fashion to the barebacking controversy, instigating a moral panic. The advent of PrEP has elicited a similar cultural backlash. The predictable response, I think, from leaders in the community and legacy AIDS activists. Now, it's important to note that these moral panics over barebacking, over PrEP, ignore the change brought about by subcultural practices that transform our notions of what counts as HIV prevention or safer sex. Safer sex used to strictly refer to wearing a condom for intercourse, but this new normal of individuals on PrEP or who are undetectable challenges this legacy notion. Many individuals bareback while insisting that they are practicing safer sex. And this is where the PrEP Backs group is a big advocate of this kind of sex positive approach to HIV prevention. The moral hand-wringing about PrEP when it arrived in 2012 was based on the idea that PrEP's early adopters would abandon condoms. But as we saw earlier, barebacking began in the late 1990s and continued well before PrEP. This is precisely why public health scientists turn to other tools to combat the stubborn rates of HIV infection among MSM and other higher risk communities. The condoms stopped working as a panacea. There's no magic bullet for HIV prevention. We need lots of different tools. Even so, as I said, with the advent of PrEP, a new moral panic arose. Again, this panic echoes earlier fears about queer cultures of promiscuity that date back to the original gay men's health crisis. And these fears turn on the cultural notion that, quote, the rectum is a grave, in Leo Bersani's memorable phrase. As Priscilla Walsh shows, the early AIDS epidemic was framed by what she calls an outbreak narrative, or the way an epidemic is rhetorically fashioned for the public. Walsh claims that there are certain features these narratives share. For example, Randy Schultz's influential journalistic account and the band Played On from 1987, made into a really good feature film in 1993, turns on the trope of patient zero, personified in the real-life figure of Gaetan Dugas, a Canadian flight attendant. Dugas was reduced to patient zero and blamed as the individual case that introduced HIV to North America. And here there's an ad from 1988, a half-page ad in the New York Times with the man's face on the cover, and the headline of the ad is, "While everyone was searching for a cure for AIDS, we discovered the cause." And if you read or watch the film version of And the Band Played On, you will see how he's depicted as this, basically as a gay typhoid Mary, willfully inflicting HIV. And this trope has been repurposed since then. Now, even early on, scientists disputed this origin myth. There's no way that one person can bring a virus to a continent, especially considering the incubation period lasts years for HIV. But the science isn't the point. The cultural logic of contagion of the rectum as a grave is the point. And this brings me to my third point. This cultural logic, oh, sorry, I thought there was going to be a third point there. Here, sorry. I guess there isn't. Sorry, I'll just read it for you guys. This cultural logic continues to promote new figures who occupy the same mythic disease carrier role. And so if we are never far from reliving the original trauma of the AIDS crisis, then any sustained transformation in the sexual behavior of MSM inspires a new moral panic, invoking the latest specter of gay male promiscuity. In short, with the advent of PrEP, we invoke a new villain with a new name, but the song remains the same. Indeed, since Gaetan Dugas, there have been a series of AIDS panic icons, a rogues gallery of patient zeros. First, there was, of course, the 4-H group, the high-risk communities that were presented as the face of the epidemic and the only ones that needed to worry about the epidemic more controversially. So the 4-H groups were the face of the terrifying outbreak: homosexuals, heroin users, Haitians, and hemophiliacs. Greater understanding of AIDS epidemiology led to evolving treatments and evolving understanding of risk behavior, which in turn generated new moral panics. These panics are meant to maintain the cultural status quo. So new panics since then, since Gaetan Dugas, have produced new panic icons. That of the barebacker, who intentionally has unprotected sex, then the bug chaser, who intentionally seeks to become HIV infected, his cousin, the gift giver, who intentionally infects a willing participant with HIV, perversely framing the virus as a gift. And let's not forget men on the down low, who infect unsuspecting, quote unquote, innocent wives and girlfriends. But as we see with the construct of patient zero, science is no barrier to the cultural logic that pathologizes non-heteronormative sexuality associated with HIV. Now, I'll turn to the PrEP backlash, which was led primarily by Michael Weinstein of the AIDS Healthcare Foundation, our own generation's Randy Schultz, you could say. According to this 2014 article in the Times, Weinstein has called the use of Truvada to prevent HIV, a practice known as pre-exposure prophylaxis, or PrEP, a quote, public health disaster in the making. He has called Truvada a party drug and asserted that his loudest opponents on the issue have all been associated with bareback porn. Starting this week, the foundation is taking out advertisements in gay-oriented newspapers across the country under the headline, "What if you're wrong about PrEP?" And the ad is right there on the left. Notice the ad is an open letter to the CDC. AIDS Healthcare Foundation also lobbied the FDA, trying to get it to rescind its approval. So again, very much a political arena for supposedly scientific findings. Again, the science is not in doubt. PrEP is effective if taken adherently. Now, promoting fear about HIV has always been the go-to prevention strategy, but such strategies are divisive. They prioritize the uninfected and they pathologize the infected. The latter are framed as fallen figures, as decadent, even monstrous specters of social risk, which here I think you have a great example of that trope. In this iconography, the cultural logic of the rectum is a grave, which animated the trope of patient zero, persists in the anti-PrEP rhetoric. But we should understand that these panics are mobilized for a normative audience, you could say it, a straight audience, with the pretext and in the context of protecting public health. Stigmatizing rhetoric, isolating certain members of the community, is meant to ideologically discipline the gay moral majority, so to speak, to encourage them to continue protecting themselves from HIV and implicitly from those who are potential carriers of it. Panic icons promote the idea of good public health citizens, in the case of Truvada, good gays. Now, in an earlier version of this talk, I argued that PrEP represents a sexual revolution among MSM, if not the whole world, because it disrupts the link between condomless anal sex or condomless intercourse and HIV risk. PrEP takes the transgression away from bareback. As Dean claims, Tim Dean, that is, PrEP licenses enjoyment without limits. Truvada shows what worry-free sex between men in the 21st century might be. He adds, it is this idea that has provoked such strong and opposing reactions. While some observers fear that Truvada will finish off the dwindling commitment to condoms altogether, others celebrate the paradoxical possibilities of risk-reduced bareback. So as Dean remarks, PrEP has changed the sexual landscape. It inspires fantasies on both sides of AIDS activism. Some celebrate the advent of worry-free bareback sex, but old guard activists like Weinstein denounce Truvada as a party drug akin to crystal methamphetamine used to quote-unquote party and play. Now, party and play is a subcultural term for using drugs like crystal to fuel barebacking marathons. By calling Truvada a party drug, Weinstein animates the specter of male homosexuality yet again as degeneracy, as addiction, as sexual threat, another instance of the gay boogeyman. Indeed, Weinstein falsely claimed that PrEP would increase sexually transmitted infection rates and increase HIV. The reasoning being that PrEP promises to finish off the dwindling commitment to condoms altogether. But as the barebacking controversy indicated, the condom had ceased to be the magic bullet a long time ago. So now enter stage right, the Truvada Whore, another queer icon, now linked to the party and play subculture. And I think the subculture is the target here. The Truvada for PrEP is a pretext for how a lot of the leaders in the community wringing their hands over this ongoing drug-fueled subculture that has a lot of deleterious effects on the community. The Truvada Whore is added to the roast gallery of AIDS monsters. Now, Truvada Whore was a term coined by gay activist and journalist David Duran, writing just when the FDA approved Truvada in 2012. Writing for the Huffington Post, Duran writes, "For men who engage in unsafe sex with other men, is this just an excuse to continue to be irresponsible?" Since then, the term took on a life of its own, becoming a hashtag, Truvada Whore, even an ironic t-shirt in the same color blue as the pill. In fact, some have reclaimed the Truvada Whore label, or PrEP Whore label, as badges of honor, much like queer was reappropriated in the 90s for the same reason. It is important to note, however, that Duran has rescinded his opposition to PrEP. In 2016, he regretted creating the stigmatizing label. Other initial opponents also changed their minds, but at first were adamant against this development, which kind of boggles the mind, including Peter Staley and the late Larry Kramer. They began to see the transformative effect of PrEP, again, to chip away at those stubbornly high rates of infection among vulnerable populations, including Black MSM and women of color. And so again, the controversy is a bit paradoxical. If you told anyone in the 90s that you could have a pill that would prevent HIV, every single person would take it. So why did this controversy arise to begin with? And again, my argument is that it's a form of reliving the trauma of the original crisis. And so a lot of these activists actually were, they were saying you should continue to use condoms just because of the legacy, right? Because your forebears who died want you to wear condoms. So it becomes this very strange, almost ritualistic argument about the past and honoring the past in a weird way, which constrains the sexual norms of today. Okay, so the Truvada Whore label does, again, trade on the persistence of HIV stigma and its cultural equation with male promiscuity, homosexual promiscuity, since the advent of AIDS. Let's not forget that AIDS was not called AIDS at the beginning. It was called gay cancer and also called the gay-related immune deficiency. More specifically, as the term suggests, Truvada Whore trades on slut shaming. As Duran wrote, quote, "For legit couples who are in monogamous relationships, PrEP might be something to consider." The idea that intercourse without condoms is only legit for monogamous couples is telling how heteronormative can you get. Ironically, the Truvada Whore trope inspired a provocative public service advertisement for PrEP in 2015. This PSA targets a specific subculture, those who, as the tagline goes, like to party, population considered the most resistant to prevention messaging of all kinds. So I'll conclude with the examination of the public service announcement. The video is entitled, "I Like to Party." The title thus ties Truvada to the whore rhetoric, which we see is linked to critiques of the party and play subculture among gay and bisexual men. The PSA is centered on a Truvada whore come to life, so to speak. Here I'm going to try to share this. Yeah, and you should be able to hear the sound. So
When straight guys have a lot of sex, they're called studs. But when gay guys have a lot of sex, they're called sluts. I like to party. And I like to be safe.
Okay. Stop share and back. This one. Okay. So the goal of the PSA is to reach those MSM who do hard recreational drugs, like again the idea of partying is encoded in that for that subculture, and who have bareback sex while on those drugs. And so in so doing, the PSA presents an aspirational Truvada Whore figure incarnated as the popular gay porn star J.D. Phoenix. At least he was popular back then. This is now 6 years ago. In this way, the ad repurposes the Truvada Whore rhetoric, turning the panic icon into a provocative and paradoxical figure for responsible party and play. Phoenix's character is unapologetic about liking to party. Now, community members who saw this ad were appalled that the ad seems to glamorize drug use and, promiscuous sex or partying and playing, given the substantial data showing crystal meth's impact on health outcomes for HIV infected and uninfected alike. But the director of the ad, Kenny Schultz, also openly admits that he wanted to find the ideal incarnation of Michael Weinstein's Truvada War. Schultz adds that he chose the porn star actor J.D. Phoenix because Phoenix, quote, makes no apologies for his work in porn or love of sex. That Phoenix makes no apologies for being a porn star and loving sex is key to being cast as the ideal incarnation of the Truvada War. It's exactly what Weinstein was stipulating, as was Duran, right, being irresponsible. The target audience similarly is imagined as unapologetic members of party and play subculture, whom Phoenix is meant to represent. Someone who, like Phoenix, could claim, I like to party and I like to be safe. The choice of conjunction is deliberate, I think, and canny. And adding and between I like to party and I like to be safe, the PSA implicitly adopts a harm reduction framework for reducing HIV sexual risk. Partying and HIV prevention are seen as compatible for once. Schultz admits that the harm reduction strategy was intentional. He wanted to reach a subculture that is already barebacking and partying. This is in fact a population that PrEP would benefit the most. Their risk of transmitting HIV would be greatly reduced if they took PrEP. Ironically, by exploiting the trope of the Truvada Whore to reach this hard partying subculture, the ad reinforces Weinstein's condemnation of Truvada as a party drug. But there's a twist. The harm reduction framework contradicts the equation of PrEP with greater risk, the equation of condom-free with unsafe sex. Phoenix clearly insists on both. He wants to party and to be safe. Now, the ad begins with Phoenix saying, when straight guys have a lot of sex, they're called studs. But when gay guys have a lot of sex, they're called sluts. This opening message frames a double standard that stigmatizes women and gay men for being promiscuous, but not straight men. We saw a shot of Phoenix's keys, some condoms, a bunch of pills, some presumably party drugs. These props signal Phoenix's mixed tagline before he says it outright. He brings condoms along, which speaks to his responsible approach to sex, which in turn is qualified or belied by his pills. Toward the end of the ad, Phoenix's grinder blows up, but so is the reminder time to PrEP. Phoenix draws out a tablet of Truvada, which he holds up as proof of his good intentions, to party and to play safe. Schultz admits that using drugs and having unprotected sex is risky. Everyone is clear on that. But it is our job, he thinks, to bring those men into the fold and meet them where they're at, not to kick them off the island and suggest that they get what they deserve. No one deserves to get a disease because of the way they experience intimacy, he says. So he leveraged the Truvada Whore icon to show that it is possible to party and have sex without being kicked off the island as an irresponsible queer and without the existential fear of HIV. This fear has been the status quo, and now it is the status quo ante. Now, indeed, since that ad, PrEP is increasingly normalized. For example, you don't hear Truvada Whore anymore. You hear prepped. So it's become much more domesticated. And so it's no longer scandalous from a public health or even a subcultural perspective. Like the original sexual revolution, the PrEP revolution does rest upon a pill, but it is no panacea. It may be, in fact, a poison pill, one that actually might cause an increase in STIs. But the jury is still against that theory. In fact, the evidence is that people who take PrEP are not any more likely to have STIs than those that use condoms, partly because condoms do not protect against most STIs. Again, the science belies this moralizing rhetoric of the condom always. Finally, in the words of a PrEP investigator, even if pre-existing rates of STIs continue to rise among MSM, PrEP means that HIV doesn't have to rise too. So today, these are my closing remarks. Today, the moral panic against PrEP seems to be fading as well. Already, the revolution has been televised in advertising on mainstream network for Discovery and for Truvada. So biomedical technologies like PrEP allow us to envision a future without AIDS, and that truly is revolutionary. Thank you. I want to just thank, oh, it's not there. Okay. I had thanks to the School of Social Work, Taricha, for all your hard work in getting this together. So thank you all, and I'm really happy to take questions if you have them. Sure.
So what will be the new moral panic?
That's a good, it's probably going to be the vaginal ring, which we've been waiting for a very long time. And I think, so in other words, I think the panic is always centered on forms of sexuality that are gendered, right? Whether it's gay male gendered or female gendered. And so I think once the vaginal ring is approved, which again, it's been like dragged on for years. It should have been approved in 2020. And I think it's not a coincidence that the new PrEP is not available for women, right? That it wasn't even tested on women, right? And that the vaginal ring is still not available, even though a lot of these cases are among heterosexual women. And so there's still a lot of foot dragging, even within the AIDS scientific community, that are not seeing who the real targets of prevention should be. So I think that's going to be it, but it's hard to know. I think part of my argument is that this has really neutralized that moralistic. I think maybe this was the last hurrah. I'm not sure. Maybe I could be wrong about that. But obviously, since the sexual revolution and the contraception pill, there's been enormous controversies, right? So I don't think it's going to go away. If you use the analogy between birth control pill and PrEP, which is a very resilient analogy.
And the sex wars, the 1980s sex wars,
exactly.
Pro-sex women or anti-porn feminists.
Exactly. And the same thing happened with the bathhouses, and of course happened again with PrEP and legitimizing barebacking. And so it's a very interesting kind of cycle of backlash and progress.
There was, so I mean, I couldn't help but think about what I heard on NPR the other day, where there's some movement afoot in Texas to outlaw the morning after pill, for
of course, ban abortion, ban
right.
morning after.
And ban the morning after pill.
Yeah, I mean, I think it is about controlling bodies and controlling desire, right? And the state's interest in doing so. And so it is kind of infuriating in many ways, because it seems like we're going backwards. At least in this country. Ironically, though, this country is the first to sanction PrEP, which is unheard of, right? So the FDA was the first one, and so it really just did become an American phenomenon. It is very surprising. Yeah, I would like to know more about it. Actually, how they leapfrogged over more permissive, and more permissive safer sex environments like Australia.
Well, and because I heard, I can be quiet. I mean, I can talk forever. And are there questions in the Zoom? Are people on Zoom asking questions? I can remember, I worked in AIDS services in the late 80s. And I can remember going to conferences where the European countries were coming out with amazing pro-sex resources for men. And in this country, it was like pathetic what this country was producing, but they were very sex positive material, sex positive brochures, cards, all of that. But I can remember, can you remember this, Pat? When PrEP came out here in Buffalo, I can remember some gay men and young gay men talking about how it was hard to get, it was very judgmental, you know, it was that negativity around it. Yeah.
Even at AIDS Community Services, which was the first medical clinic. Okay.
Yeah. So
Yeah, and I've
anyway,
got a question about how hard it is to get. Because I guess I'm cynical and jaded, and in this country, I know that something that's supposed to be accessible and available is not accessible and available to everybody.
right.
So I'm wondering if you could speak to accessibility and availability, and the other part that I'm gonna throw in there. I'm just really wondering about the role of the pharmaceutical companies. And again, I'm feeling cynical and jaded, and maybe that's why this is getting promoted, because it's a drug that people can buy, and maybe somebody has a vested interest in this. So I'm wondering if you could speak to those things.
Absolutely, and that's why I mentioned earlier when some of the active activists that at first were against PrEP changed their minds, but they have now been lobbying against Gilead because of Gilead's malfeasance, right? They ignored half the population in testing their new drug, Descovy. They switched to Descovy marketing as soon as Truvada became generic. They've made billions, and they make billions and billions a year through this regime. And so yes, it's good to be cautious and to also think about the repercussions of having healthy people on basically chemo prophylaxis, right? Like, what is the long-term effect, right? And so there's reason to be skeptical and cynical, as well as to wonder about this, because if you take it every day, it works, but you have to take it every day, you know, indefinitely. And so that's one of the issues, right? The other issue that you rightly point out is accessibility. So Gilead has said, we'll make it available with a copay assistance program if you have insurance. So there's a lot of hoops. If you don't have insurance, there's another assistance program. So if you are very savvy, if you have private insurance, you can get it for a zero copay. But again, if you have to really maneuver, your paperwork has to be on point, that you have to remind the pharmacy, for example, that it should be a zero copay. So there's all these incredible cognitive burdens and also expectations of insurance coverage. To be able to pay nothing, you have to have insurance. So you're paying a lot actually to have insurance in this country. And then to go back to the doctor issue, right? A lot of these PrEP doctors have to educate their own doctors about it. A lot of doctors don't know anything about this. And so it really is difficult to access it, even if you live in a major city, right? Because you do have to educate your doctor. I had to do the same thing when I applied for PrEP in Boston. And my doctor was a major AIDS physician. And so he did it almost reluctantly. He said, well, how long do you think you want to be on that? And so I think this moralism persists. And it's almost like we don't see how urgent this epidemic is. And I think it's because we've had these successes, ironically, from treatment, that we don't see that this is raging in so many parts of the world, including in our own world, in this country, right? There's a recent New York Times feature about Black MSM in the South and how the rates there are comparable to some rates in sub-Saharan Africa, right? And so PrEP is one tool, and it's good to lobby the drug makers to make it available, to make it free. A lot of that research was funded by our taxpayer dollars, and yet the profits are all Gilead. And so what Gilead's done is say, we're going to still charge and keep the intellectual property over Descovy, but we're going to, again, do these subsidies, right? But again, as we know, the subsidies have all these strings attached. And if you're not savvy enough to maneuver through the health system, you're not going to be savvy enough to do PrEP regularly, right? The other piece to that is that you do have to have labs every 36 months because you have to be tested and proven to be HIV negative. Otherwise, you have to get off of, ironically, you have to get off of Truvada because you have to have a different system, a different therapeutic system if you get infected, kind of like the breakthrough infection. There's been very few breakthrough infections, but you are pointing out the kind of the class and racial privilege that is sustaining this drug. And so I think that's where a lot of the activists are going. They want it to become free, they want it to become available. So far, it's only people who know about it, right, who actually access it, and that assumes a certain level of education, of wealth, that not everyone has. And again, the people who don't have it are the ones who actually need it the most, right? It's the ones who may not be able to have a doctor, a regular doctor, for example, right? And so again, the way that we structure these treatments or these prevention tools, it almost seems to prevent the actual breakthroughs in terms of success that the tools promise, right? And that's without even thinking about the moral imperative that's going around in terms of what it means to forgo condoms for the future. So it's very complex, but I do think it goes back to the role of big pharma. And so again, it's not a coincidence that Descovy was put out there as soon as Truvada became generic. And actually, to your question, it's actually really hard to get insurance to pay for Truvada now that Truvada is generic. So it's like they're forcing you to get the more expensive branded drug, but there's a subsidy, but only if you can get it, but only if you, so it's all these, it just perpetuates the status quo.
Which leads into the question.
Yeah, the medication available.
Oh, yeah. Yeah, that's a very good question. I actually don't know the answer to that. It's a really good question. Again, because there seems to be so many barriers within the medical establishment that even know about it, right? And part of it is this kind of moralism, like why do you need to be on this drug? Why should I, as a taxpayer, subsidize your promiscuity? Is another version of this argument, right? And so I think it's a really important question. I'll have to look into the prison population, but I'd be very surprised if it is available. Right, because of all the you need to have a physician, you need to have these labs, they have to be regular, right? And so it's a whole infrastructure that has to be in place. And again, the burden is on the individual to be able to navigate that infrastructure and remain within it. And that's one of the critiques of daily PrEP. So what's happening now is actually moving towards a long-term injectable as the future model, which is seen as more sustainable than a daily. So again, the modalities are changing because they are seeing how many people can fall through the cracks.
What would be the long-term projection?
Like a month.
Okay.
A month, which the other piece of this is the absence of a vaccine. And so I think COVID, the HIV/AIDS vaccine effort has been a dismal failure. When I did AIDS research, I was in the vaccine effort, and they even had one vaccine that increased your chances of becoming HIV infected. So COVID, the silver lining to the COVID vaccines is actually that now, for example, Moderna is starting clinical trials on an HIV vaccine. And so the mRNA, kind of breakthrough with COVID might promise a real vaccine, which is what we've been promising people in terms of HIV/AIDS since 1993, right? Clinton famously said we'll have a vaccine in 10 years, and it's 2021. And so hopefully we'll have something that's a little bit more durable and accessible, like we did with the COVID vaccine. And a lot of people are actually quite confused or angry that we were able to get a COVID vaccine so quickly. And we've been lingering for 3 decades now with the HIV vaccine with no success. And some of the skeptics would say there's a reason why, because there's so many billions on the line with these treatments that are not cures.
The other thing about prisons, I think, is, you're not supposed to have sex in prison.
Exactly.
You're just supposed to sit there and do nothing.
Exactly. Yeah, and the denial of all the sexual violence that occurs in prisons, I imagine. Right?
Yeah. And taxpayers seem to have no trouble with funding Viagra. Is the other.
Exactly. It's such a masculinist kind of structure, and it goes all the way through the entire scientific community.
The slut thing that we saw.
Right.
Exactly. Which the focus on the condom, for example, like that's a non-starter for a lot of receptive partners, right? Who may not be able to negotiate condom use. Say if you're a sex worker, for example, right? You're going to get more money if you are if you don't use a condom. And so again, even the scientific community itself has been so narrow-minded in its approach in helping people protect themselves.
So what's next as far as, publishing or new areas on this that you're exploring?
So I'll be I'm putting together a monograph that's going to be looking at these different panic icons. So I'll be doing one on the down low, which is so it's even like you can even track it. Like so the barebacking was 99, the bug chaser was 2003, Truvada Whore is 2012. It's almost like they're landmarks in the history of HIV/AIDS. And so the down low would be the next step for me, and that's a very interesting and tricky and an interesting kind of archive. So there was like an Oprah special about the down low. So again, this kind of demonizing of the male and positing the innocent victims as female, which is kind of like the flip side of not allowing women their autonomy sexually, even in the context of HIV/AIDS. So I think the down low and the racialization, and also the criminalization, right? So a lot of these statutes that criminalize not disclosing. So I think the down low is one area that I really want to lean into, because it does bring up the questions of disclosure and accountability, right? So in some states, if you don't disclose your status, even if you have safer sex, you can still be charged and imprisoned for that, for that refusal or resistance to disclosure. So it criminalizes even simply the discourse around HIV, which is crazy. And again, it's deeply racialized as well. And so I think that would be one other, and that was around, I want to say that was maybe 2005, but I could forget. I forget at this point. That was, rose to the level of Oprah at that point. And so it brought to the surface women and AIDS, which is good. But again, it did so by mobilizing this trope of, deviant male queer sexuality, men who are, infecting unsuspecting lives with their elements. So that would be another aspect of this. So I mentioned the feature in New York Times about, I don't know if you guys read that, it's about Black men in the South. And a lot of them are trying to, move beyond this code of silence that is also very regionally specific, right? And so as you were mentioning Texas, right? The South is notorious for not having adequate healthcare infrastructure and not having any kind of public discourse around HIV. And so that's one of the issues that this down low kind of touches on, but in a way that demonizes as opposed to exploring these constraints. So yeah, that's what's next. Yeah, it's an interesting archive. I think it's very fruitful, and I do think there is an end debates, right? Because that's where a lot of the WHO and the UN is going, right? In fact, that's part of the policy goals. So we could see an end debates as an aspiration, but again, it requires all of these competing interests to become organized, right? And I'm not sure when that's going to happen. So yeah.
Just a comment I wanted to make is I appreciate it, and I think for any presentation, you took the time to explain barebacking and so forth. I mean, I just think that was very considerate of your audience. So thank you.
Sure. Yeah, absolutely. I know this is subcultural, so not everyone knows about this subculture. But yeah, it's kind of it's harkening back to my work in AIDS research, where we saw a lot of these clients, and we kind of wrestled with how to reach them. Because the ones that come into this kind of prevention work are the ones who already know that they should be protecting themselves. So that's why I appreciated this PSA as well, kind of speak to that audience. So yeah.
So I have a question. So what is the current research around maybe the side effects of long-term use? Has it been associated with toxicity for the kidney?
Yes, it has.
I do worry about that too.
Absolutely. So fair disclosure, I switched to the SCOBY because I did have the renal thing. So my doctor recommended that. There's also bone density loss for long-term use. So you got to measure that. Again, this requires a really robust medical insurance system behind you to really monitor like that. Right, and a lot of the most vulnerable populations, say, are unhoused, or again, they have a very different relationship to sexuality and to stability and to the medical system. And so the other piece to this, though, is that Truvada has been used for a very long time. I believe it was maybe 2006, and it's a combination of two already existing antiretrovirals. So it's been used as a treatment for a long time, and it's been a safe treatment. So that really kind of qualifies the fears around it. But on the other side, these are quote unquote healthy people, right? And so there's a different calculus of pros and cons if you have no actual infection and taking this very potent pharmaceutical, and whether you want to take it for life. So there's also a new non-FDA approved regimen that's basically Truvada on demand or PrEP on demand. You take 2 within 24 hours of sexual intercourse, and then you take 1 within 48 hours after intercourse. And that can also be effective, almost as effective. I think it's like 86%. So that would mean that you don't have to do this daily adherence, which can be very difficult, right? For all the reasons that we mentioned. And so that might be one way to mitigate the risk of the toxicity when you're not doing it every day of your life, but you're just doing it as, on a need basis. So, but yeah, I think we, in a way, turned the corner. And I think one of the most important take-home messages from this whole controversy is that pleasure should be the center of HIV prevention, not fear and stigma. I think that's where the PrEP Facts group is really good. Even though they kind of get a little carried away with barebacking is liberation, they are focusing on pleasure, and you turn off a lot of people if you isolate sex as merely a function of risk and behavior, and you medicalize sexuality, and you're going to lose a lot of people. Whereas if you talk about pleasure, you're reaching everyone that actually does have that relation to intimacy that might not be about public health, but those are the ones that you generally want to reach in public health. So I think there's a lot of work to be done.
Can you imagine how lovely sexuality education would be in high schools and junior high schools if we centered pleasure, and the sexual rights of young people? I mean, I can't even imagine that happening.
That's right. That's right.
So it happens in like pockets,
And Denmark. And
And it's
Pockets
in
in
another
Denmark.
word, we're just such an anti-everything.
Yeah.
Oh.
My students, I asked them when I teach a class based on HIV/AIDS research and writing, I asked them which of them had heard of HIV before coming to the class. And some of them have in health class, but a lot of them haven't heard of it, or they think of it as a historical
Haven't
phenomenon.
heard of HIV?
Not
Oh,
exactly.
my goodness.
They hear it as in like, if you're gay, you have it. It's kind of like a schoolyard taunt, as opposed to like something that's taught as an ongoing epidemic that you might think about protecting yourself. So it's really become invisible and unspoken in like the majority of this country, actually. So it's sort of turned a circle back to mostly MSM are really that, at least in this country, right? Because the demographics of it have shifted globally, right? And so that focus, around 2003 is when PEPFAR was instituted by Bush 2, and that really showed that that AIDS was becoming a heterosexual epidemic, and so that really kind of changed the visibility of it in this country. So I mean, weirdly, COVID has actually made it more relevant, but I think even now there's still so much stigma attached to sex itself, as you were saying, and to HIV because it's a sexually transmitted infection that it's really hard to normalize it in educational settings or even in the medical setting with your doctor, right? It's almost like you have to justify why you even want to know about PrEP. And then if you do want to know, you have to tell your doctor about it because they usually don't know. So it really places the burden on the consumer or the patient to be educated. And so there's absolutely no resources devoted to this in this country at least. So thank you so much again. This has been lovely.
Thank you.
I hope, and thank you for joining us online.